So, dear colleagues, I'm really happy to present this case, and no wonder that we start with cystic fibrosis patients, because these patients, of course, profit most from good physiotherapy. I'm sure of that. So let me present just our very first impression with Simeox, with the case of the patient born in 1997. Cystic fibrosis was diagnosed at the age of 1.5 years old and confirmed by positive sweat test and 2 mutations of gene CFTR. So she has severe genotype. That means that she is pancreatic insufficient, and she has chronic Pseudomonas infection since the age of 5. Well, her characteristics are as follows. So she's 20 years old, and she has moderately severe obstruction, and has quite low body mass index, so she's planned for gastrostomy for nocturnal hyperalimentation. And she was hospitalized in our clinic. Her CT scan is quite characteristic for CF patients with multiple diffuse bronchiectasis, peribronchial infiltration, and pulmonary infiltration, local pulmonary fibrosis, and you see quite a lot of mucus plugs, so she really needs something new for her physiotherapy. So her microbiology, she has got quite she has got moderately resistant Pseudomonas infection with Pseudomonas aeruginosa and Pseudomonas aeruginosa mucosa, though she is negative for tuberculosis or non-tuberculous mycobacterium. And she was treated with mucoactive inhalation therapy with DNase and hypertonic saline, with IV antibiotics, with 2 anti-pseudomonal antibiotics, and her physiotherapy was as follows. She started with active cycle of breathing technique, and for 5 days she was giving Simeox twice a day. So here she is. She started we started with 20 minutes per session twice a day. Then it was 25. In the end, it was 30 minutes per session. So she was sitting upright. That was most convenient for her. But of course, she changed position sometimes just to make this physio more efficient. So at the beginning, as I told, she had FEV1 of 45% predicted, and in a week's time, with medical treatment, it increased till 49%. Then we, on top of medical treatment, we added Simeox, so she continued to increase her FEV1 predicted. In the end, it was 56 and a half, and of course, it means a lot for CF patient. For adult CF patient. So actually now I would like to give a chance for you to hear a bit of her voice. So that is the questionnaire she completed in the beginning of Simeox treatment and at the end of Simeox treatment. And here she completed the questionnaire about her general well-being, and if she is it is a nuisance for others, her cough, and of course such general questions did not change in 5 days' time. But when we had questions regarding her cough and her sputum, if she has less sputum, or if she's less congested, you see that her answers show that there was a progress in during the Simeox treatment. And here is the last questionnaire about what she thinks about the new technique. And you see, she decided that just the faces is not enough. She wanted to verbalize all her answers. So she showed that the ease of use is quite easy for her. It was quite easy for her, and the training was quite quick. So the device for her was convenient to use, and the training was quite easy. She thinks she could use this technique alone, and even she wrote "уверена да," which means yes, I'm sure. And when she was asked would she like to use the device at home, she said she wrote "очень хотела," which means very much so, and she would recommend it to other patients. So I suppose that is the most important point for us now. That is what our patients think of the Simeox, and of course we need more studies just to make it more objective for us to judge how it works in clinical practice. Thank you.